guys, this is my journal club for September. So I chose the article, The Circadian Rhythm of Cardiovascular Disease, The Potential of Chronotherapy with Aspirin by Marlene Burma as the primary author. It was published by the Department of Public Health and Primary Care at Leiden University Medical Center in Leiden, Netherlands. So the main thing that attracted me to this paper was first, I really thought the cardiovascular aspect of circadian rhythms was very interesting, and I didn't realize that somebody was actually investigating aspirin. So this paper looks at if aspirin taken in the morning or night affects the number of cardiovascular events in the morning. And the cardiovascular health, to me, has always been very interesting. And I'm curious to see, just from reading this article, if the early morning cardiovascular events can be manipulated. So I came across this article from the Biological Rhythms class page. So the study, the study looks at these several different studies as its results to aspirin's use and chronotherapeutic effects. So it takes a combination of several different studies and looks at all the results and puts them together in different aspects, and not including just chronotherapy, but a few other aspects too. And then the research question that they asked was, can the optimal timing of a medicine like aspirin reduce the number of cardiovascular events? So this question is important because statistically more cardiovascular events happen in the morning, and these have a larger infarct size and worse prognosis compared with those that happen during the rest of the day. It is thought that there is less or impaired platelet aggregation at night. Less or more impaired platelet aggregation at night. If aspirin can really exert a therapeutic effect, then this could reduce these events, maybe even drastically. There's also more sympathetic activity and increased renin-angiotensin activity in the morning, which can contribute to a rise in heart rate and blood pressure. There's also less basal endothelial dilation in the morning and more hypercoagulability. All of these combined can result in a higher chance of cardiovascular events in the morning. So the methods of the study is they pretty much just looked at a bunch of different studies. They didn't actually do it themselves. So those questions to go through aren't really needed. So the primary results of the study, so they looked at several different aspects. First, they looked at the dose of aspirin. So 2 trials they concluded demonstrated sufficient levels of platelet inhibition with once daily dosages ranging from 75 to 325 milligrams. They also looked at the frequency and found that a higher level of platelet inhibition, there's a higher level of platelet inhibition if the frequency was increased to more than 1 intake per day. And this only applied to those with ongoing cardiovascular disease, not in healthy individuals. And then the last thing they looked at was obviously chronotherapy. And from the studies that they were looking at, they concluded that once daily evening intake was superior, since you get platelet inhibition overnight and into the morning. But they did conclude that there's need for further studies. So that's very interesting that if you take it in the morning, it'll kind of cover you if you take it at night, it'll cover you into the morning. But if you take it as soon as you get up in the morning, it's already kind of too late and those cardiovascular events can happen. So describe why you think the results can or cannot be applied in your own patient / situation. For me personally, this can be applied because I could adjust my dosing regimen so someone can get more benefit by changing the dose frequency and time of day it is given. But since I'll be going in OBGYN, I probably won't be prescribing aspirin that often, except for maybe in patients who are on like an estrogen, OCP, and I'm trying to reduce their risk of venous thromboembolism or cardiovascular event. So this isn't something I'll regularly be doing like a family medicine doctor, but it is something I can consider for those who have a history of cardiovascular disease and they want to be on some sort of OCP. So overall, this was a pretty interesting article. It was an easy read, and I would recommend it. So thank you for listening.